is Cynthia Marvers, and I'm from Nassau, Bahamas. I found Dr. Badia through a friend of mine. Yes, I had severe pain in my right shoulder going all the way to my fingers, and I could not move my hand.
Our patient, Mrs. Mavros, is a middle-aged female from the Bahamas who'd been having several years of shoulder pain. This is an exceedingly common problem in the general population, but in her case became greatly worsened after a minor fall. MRI was done, as often is the case, and showed that there may be a rotator cuff tear. Frankly, when I saw her in Miami, the clinical exam was more consistent with what we call a frozen shoulder, which is an adhesive capsulitis. At the time of arthroscopy, which is where we insert a camera into the joint itself, I could see that the capsule was very thickened, very stiff, and that causes pain. The rotator cuff really was a minimal problem and didn't require repair. What we did is freed up the capsule. We manipulate the patient's shoulder in the operating room while under very heavy sedation. And that same night, the patient started moving the arm with something called a continuous passive motion machine. We often couple that with something called ARP wave, which is a neurotherapy, where in the operating room we apply some electrodes to the shoulder right here, and that helps minimize the post-op pain and helps the muscles actually fire their electrical signal from the nerves to get the arm moving. Patient was moving the arm the very next day and has done her therapy in the Bahamas, where we have a good relationship with the therapists there. And I saw her today, noting that she has almost full motion already and none of the pain that she had preoperatively. And this was less than 2 months. So the point being is that when you have joint pain, in this case the shoulder, it's really important to see an orthopedist, a specialist that deals primarily with that joint in order to get the optimal care and the excellent resolution that this patient had.
Dr. Badia was amazing. He was very hands-on, and he went over the procedure, so it was quite easy. I would recommend him 100%. The staff and after service and everything was awesome.